So hi, my name is Mr. Hove. I'm from Bluefin Vision. We're based in London, Chelmsford and Hatfield. This video is talking about the differences between laser eye surgery and lens replacement surgery. So patients who come to us are effectively saying, I don't want to wear my glasses or contact lenses. And a lot of patients are expecting to have laser eye surgery. And laser eye surgery is the correct procedure generally if you're under the age of 40. So under the age of 40, if your prescription is -5, we can do laser eye surgery where we reshape the cornea, which is the front window of your eye, and we actually make the cornea slightly flatter, and that changes the focus of the light, so the light is pushed further back and in focus on your retina. And that's a procedure of choice because under the age of 40, anything between 21 and 40, your natural crystalline lens inside your eye still accommodates. And what that refers to is your natural lens can change shape to allow different focal lengths. So once you've had the laser eye surgery and you stop being -5, your natural lens then allows you to switch from focusing for distance to see things as you're walking around watching TV driving, to being able to read the detail on your phone or your laptop, and your natural lens will do that naturally and you don't even know you're doing it. Once you get past the age of 40, your natural lens loses its elasticity. And that gradually leads patients to needing reading glasses. So if a 45-year-old patient or a 50-year-old patient turns up saying, hey, I want to have laser eye surgery, though the laser eye surgery might correct their -5 prescription and make their prescription 0, the problem that they may run into is because their lens is losing its elasticity, you might get rid of the -5, but within a year or 2 or 3, you might be needing glasses to read. Bear in mind the average age of needing reading glasses is 51. So if you take a 45-year-old patient and you do laser eye surgery, if they need glasses at the average age at 51, they're going to need reading glasses. And they might therefore not look back on the procedure and think that that was money well spent because, yes, they stopped needing glasses because they're -5, but now they need reading glasses, and reading glasses really make you feel old because you've got to put them on, take them off, and every time you look at your phone, you've got to put on your reading glasses. So they're not necessarily going to be thanking you for that. So the reason why I would then suggest that these patients are better candidates for lens replacement is because lens replacement actually deals with not just their -5 prescription, but it also deals with the fact that their lens is getting older and deals with the problem of the elasticity of the lens. So what then happens is, instead of doing laser eye surgery where we're reshaping the front of your eye, we're going to go into your eye and remove your crystalline lens, replace it typically with a trifocal lens, and that trifocal lens will give them good vision for distance, intermediate, and near vision. So they're free of glasses, but this is potentially going to last them the rest of their lives. So instead of having one laser eye procedure at 45, 46, and they need reading glasses when they get to their 50s, they have lens replacement once at 45 or 46, and then they don't need glasses at all. The other benefit of lens replacement in these patients is when you get into your 60s, you aren't going to develop a cataract because the cataract is the natural crystalline lens becoming cloudy as you get older. And because we've removed that crystalline lens as part of the lens replacement procedure, you're not going to need any further operations. So in reality, we will be doing lens replacement in patients typically over the age of 40, but anyone over the age of 40, it's probably a better option to be having lens replacement as opposed to laser eye surgery. It doesn't mean you can't have laser eye surgery, but it's definitely something you need to consider and weigh up carefully, because if you opt for the laser eye procedure, you're likely to be needing to have either reading glasses or a second operation subsequently, and lens replacement will do everything all at once. And lens replacement can be done all the way into patients into their 60s. By the time they get into the 60s, they might well be heading towards cataract. But I've had effectively the lens, not lens replacement because I actually had cataracts, but I have the premium lenses that we use for lens replacements in my eyes. And I'm an eye surgeon and I've been able to work perfectly. I'm still free of glasses and the lenses work amazingly well. So I'm actually in quite a unique position because I can not only explain the procedure to you, I've done 50,000 of these operations, but I've actually got these lenses in my eyes. And it allows me to explain in greater detail to patients what it's like, the glare and halos they might experience, what having the procedure is like, because I've had it myself, and I also do the procedure. So I bring a unique experience to the patient, both the expertise and the being a patient in the lens replacement. Whilst I never had laser eye surgery, I know my wife has had laser eye surgery. I've done thousands of laser eye surgery procedures so that I can explain well, and I bring a unique set of skills for my patients. Thanks.